Good morning, students. Today we'll be looking at Chapter 30 on substance abuse disorders. And let's jump right in. All right, so substance use disorders is an umbrella term for substance abuse and substance dependence, and we'll look at those definitions in a minute. Substance abuse is basically repeated use of a drug or repeated use and abuse of a drug, which leads to negative consequences, meaning that maybe you might lose your job, you can't get up in the morning to get to work, you're dozing off in a relationship, and so the individuals are wondering what's going on with you. So those are negative, or rather dysfunctional consequences. So substance dependence is the use of drugs or alcohol despite those negative consequences. So we see in substance abuse or use, you'll have problems leading to dysfunctions, and you'll have a lot of dysfunctionality problems when you abuse drugs. Getting to work, social function, your social functioning, relational functioning, you'll have problems with that. Addiction, let's look at that term. Addiction is the compulsive use of alcohol or drugs. And it's just a whole physical and psychological compulsion, okay, to have this involvement with drugs. Tolerance is when your body finally gets somewhat sensitized to the alcohol or drugs, and then you need more alcohol or drug to get the same effect. So that is tolerance, and that comes from, of course, repeated use. Withdrawal symptoms are very uncomfortable, painful symptoms when you discontinue taking a drug or alcohol. Okay? And as of, I have as far as back as 2010 statistics that state that nearly 52% of Americans 12 years or older reported current binge drinking of alcohol. Okay? And 21.8 million Americans 12 years or older, that's 9% of the population, currently use illegal drugs. So 21.8 million. All right, alcohol abuse statistics as of 2002, alcohol abuse increased. That's quite a far back. I don't have more recent statistics, but alcohol abuse increased by 4.65%. All right, in 2005, 41.9% of males and females 18 to 25 years old reported binge drinking. And so drug abuse statistics, this is slide 6, drug abuse statistics, prescription drugs, especially opiates, from 2002 to 2009, an estimated 5.3 million people abusing prescription drugs, okay, accounting for up to 1 million visits to the ER, emergency department, in the U.S., and that was as of 2005, that they were mostly drug-related. Factors influencing substances, age, I think more so the younger people, younger age, more being that they're curious and there's peer pressure, they can have a tendency to be influenced more. So age is an influence. Sex also is an influence, and males being influenced, sometimes more influential than females. And ethnicity depends on what the ethnic class is. White males drink more, um, more than Latin American or blacks, and uh, let's see, and drugs. I think Latin Americans and Africans use more drugs, higher amount of drugs than do whites, even though whites are not far behind. Social settings has a lot to do with what influencing one to use of drugs or alcohol. The availability of drugs, if it's more available, then that that will influence the use. The cost, if it's cheaper. Peer pressure, we mentioned. But no matter what, it whether or not these factors are there, regardless of the factors, substance abuse disorders are impair physically and socially and psychologically at some time in the during an illness. So the person's illness, it's going to impair them either physically, socially, or psychologically. Factors influencing responses to drugs. All right, so we have the dosage. We have a high dosage, then you'll respond more. Frequencies also. The route of administration. IV is faster than PO, right? And IM is faster than IV and PO. Per rectal, okay? Intrarectal. Well, that's pretty fast. I once heard a story about a man who had throat cancer from smoking and drinking, esophageal cancer. So they had to cut out part of his esophagus, and they were going to do some reconstruction surgery on it. But while he waited, he wanted to drink. So he asked his wife to give him alcohol enema. And alcohol enema, it'll get absorbed and he'll get drunk on it. And that's what he did. Okay, so then we have individual factors like biologic, behavioral, social, and psychological factors. All right, so your body makeup, biologic. If you have small frame body, skinny, you're gonna respond faster. Socially, it depends, and psychological factors. All these other factors might play a part in it. Alcohol-related disorders. All right, so alcohol, also known as ethanol, and it's abbreviated ETOH. Okay, so alcohol is basically a depressant. I know people sometimes they drink and then they feel elated and whatever, and that's kind of like, yeah, okay, for the moment you might get a little bit elated, or you're thinking maybe because all the sugar, the glucose is going to your brain and etc. But eventually it depresses you. It depresses the system, the CNS system. So it does alter your mood too. It could make you irritable, it could make you happy, whatever. All right. So let's talk about proof. When we're talking about the proof of alcohol, when we say proof, we're talking about how much alcohol is actually in that bottle. If I say that it's 100 proof, then what I am actually saying is that there's 50% alcohol in there. The rest is other stuff. Okay. All right. So 100 proof is 50% alcohol. In order for something to be 100% alcohol, right? They don't sell 100% alcohol. Okay. So if you're looking for 100% alcohol, it would have to be how much proof? Right. 200 proof. Correct. So it would have to be 200 proof to be 100% alcohol, and that's that kind of alcohol is restricted to the laboratory, for laboratory use only. They don't sell that. So I mean, you can get really high proofs of alcohol, but it's illegal to sell 200 proof alcohol. Okay, probably kill you anyway. Uh, Alcohol abuse patterns. Basically, with alcohol, you get sedated. It impairs mental functioning and it impairs motor functioning. We've all gotten a little bit tipsy at one point in our lives. We know what this is all about. You get a stupor, like and decreased stimulus response, including painful stimulus. You won't really feel that. Sometimes people drink and they say, I don't feel anything. And eventually you'll have coma and eventually death from respiratory and circulatory collapse. So it is a strong CNS stimulant. Okay, there was a story about a professor that that I had in the School of Respiratory Therapy. I was a respiratory therapist also at one time. I went to school, and my professor said one time he had gotten so drunk, they were drinking vodka and while they were on campus, and he went outside and he just fell out, and it started snowing, and he was in the snow, and he had drank so much alcohol that he didn't feel the cold, and the alcohol just kept him from freezing. Anyway, true story. Next slide. That's slide 11. Factors affecting alcohol concentration in the blood. Okay, absorption rate. How fast does it absorb? If you have food in your stomach, it's going to take a little longer to absorb. Okay, how fast does it distribute to parts of your body? Okay, different things might affect that. Enzymes in your body. Okay, that'll break it down. And there's metabolism. You know, how fast is the liver metabolized? For men, the alcohol is metabolized a little bit, metabolized, I believe, a little faster for men, a little slower for women, so it takes a little more time. And elimination also is a key in affecting the blood levels. Okay, so DUIs. That's defined as the blood alcohol level of at least 0.08. Okay, so that's equivalent to how many drinks? Right, approximately 2 to 3 drinks. Okay, so in order to reach that level, in 2 or 3 drinks in an hour, you know, that's really what that is. Okay, so in order to reach that level, let's say if you didn't eat anything, you'd get there real quick. If depends on what you're drinking, I guess, and also male or female, how much do you weigh? You know, a big person could probably do that okay, but 2 or 3 drinks is not going to get you to 0.08. Not normally. If you're a normal person, okay. If you're a big person, then it's going to take a while. If you weigh more, if you've eaten, it's going to take a little while more. Okay. So, excuse me a minute. All right. DUIs in states that have low tolerance or zero tolerance for DUIs, you can be arrested, your car could be impounded, and you may have problems with your licensure. Okay, if you're a nurse, if you're caught in certain states and you are DUI. All right, just food for thought. Careful driving. Remember, 2 to 3 drinks in 1 hour can get you to a 0.08. Okay, so be careful. All right, so effects of heavy use of alcohol. There are what's called blackouts. Blackouts are when you drink to the point that you don't remember what happened. Okay, now you didn't pass out or you didn't faint. You just don't remember what happened. Okay, passing out or fainting is another. That's losing consciousness. That can happen too, but this is just, you can't remember what happened. Okay. Intoxication is basically after excessive drinking. You start behaving crazy. You start fighting, or you show bad judgment. You do something crazy. You get slurred speech. Your gait is unsteady. You lack coordination. You put a lampshade over your head and you start dancing around. Or maybe you strip, take off your clothes, and you start doing a strip tease for the men in the room. Hooray! Okay, so anyway, that's intoxication. Tolerance is prolonged heavy use and results in physical and behavioral tolerance. Your body just gets used to it. Okay, what are the heavy effects? What are the effects, rather, of heavy alcohol use? Continue. There is also withdrawals. Withdrawals are when you stop drinking or using, for example, a drug or alcohol, but we're talking about alcohol right now. Then you can have what's called delirium tremors, and you could just go through basic withdrawals. So we'll talk about delirium tremors first. You stop drinking, all of a sudden your blood pressure starts going up, your pulse rate goes up, you get anxious, you might start having tremors, you'll start sweating, you'll get irritable, you can't sleep, and you may even start hallucinating. These are withdrawal symptoms. Now, delirium tremors are within 48 hours. You get very agitated. You start shaking tremendously. You have high anxiety. You'll have a fever. Your heart rate goes up and your blood pressure goes up. Withdrawal symptoms usually can occur 12 hours or less after you stop drinking. You'll start seeing some tremors and maybe some anxiety. But delirium tremors, definitely within those 48 hours, okay? Also, physical complications of using alcohol. We know your liver's going to get shot. You're going to have high liver enzymes. You might get a cirrhosis of the liver eventually, and because your liver breaks down the alcohol. And then you have your pancreas, which breaks down the sugars that are in the alcohol. So eventually your liver and your pancreas are going to get shot. Also, your central nervous system is going to have some dysfunctions. There is something called Wernicke's, which is ocular disturbances. You have trouble kind of seeing, and you may start developing dementia, the alcohol destroying brain cells, and you may start becoming ataxic, unsteady gait. Usually what they give for this is thiamine. In the hospitals, they'll start put you on thiamine, and that helps to ward off Wernicke's, okay? Then there's also Korsakoff syndrome. Korsakoff's is when you start having short-term memory loss. You also have gait disturbances, but basically when you have Korsakoff, you have difficulty forming new memories. Okay, so your short-term memory or new memories cannot be produced really well, and you start forgetting things. All right, let's go now to stimulants. Okay, so what can stimulants do? Stimulants can increase energy. It could make you more alert, elevate your mood, but they also cause you to be irritable, and they can cause anxiety. I know when I said increase energy, alertness, and elevate your mood, you said, whoa, I need that so when I study for my boards or something. No. So we're talking about amphetamines. We're talking about methamphetamine, MDMA, ecstasy, which is ecstasy, and cocaine. These drugs all are stimulants and can give you energy, etc. We also have cannabis, which is marijuana, and hashish. It can be ingested orally or smoked, and it induces relaxation and pleasure, and a distortion of space and time, and you get the munchies also you want to eat. Hallucinogens, we have LSD, etc., and PCP, uh, phencyclidine, which give you euphoria and alteration in perception, memory, and judgment. Usually, patients present in the emergency room with dissociative states. It's almost like they're zoning out. They're somewhere else. They're not here when you have these patients, when you see these patients in the emergency room. Opioids. Opioids have been used for years as pain relievers. All right, we have opium, heroin, morphine, codeine. Um, okay, so we get you feel very euphoric, and um, you feel pleasure and no pain. Okay, so these are pain relievers. So for opioids, what we use is we use Narcan to reverse opioid intoxication and overdose. Okay, opioid withdrawals are very painful. There's a lot of discomfort involved with those. You get a lot of cramping and tremors, uh, panic and chills. You feel like you have the flu and you're going right through it. Okay, so very painful painful process, withdrawals through opioids. Sedatives and hypnotics, anxiolytics, like benzodiazepines, they're all used to treat anxiety and facilitate sleep, relaxation, but they also impair judgment, and the person behaves sort of like they've been drinking alcohol. Um, Rohypnol and gamma hydroxybutyrate, GHB, are two date rape drugs that are used. Okay, so these are also sedative hypnotics. All right. We remember that barbiturates or benzodiazepines, if a person has been using them for a while, they've been using or abusing them for a while, and all of a sudden they stop taking them, you could have seizures. Okay, why? Because they raise the seizure threshold, the the benzos, and so when you stop taking them, the seizure thresholds abruptly drops. Common psychiatric illnesses linked with substance abuse. We have schizophrenia, um, antisocial personality disorders, the sociopaths and the psychopaths, anxiety disorders, and mood disorders. All these individuals usually wind up abusing drugs. Not all of them, but some of them. Uh, Two main objectives of treatment for clients with substance abuse is safe removal of the chemical from their bodies. Okay, this is page 639. You need to look at it real quickly so you could familiarize yourself with that, and definitely breaking through the denial that perpetuates the illness, because a lot of these people are denying that they have any problems, and what they do is they use the drugs and they're covering up some anxiety, some psychological conflict that they're having, internal conflict, and they're in denial. Short and long-term treatment programs. You have short-term programs like the Willows, short-term inpatient residential therapy. That means they live there. This is more residential therapy where they get more therapy and not detoxification like they do at the Willows. Outpatient rehabilitation is another one. Private practice physician treatment, that's when a physician treats them. And then we also have long-term approaches. We have medication maintenance programs like methadone maintenance for opioid abusers, and that's long-term. They come every week or every day, and they get their methadone and they take it. And then there's also disulfiram, antabuse, where the patient drinks the disulfur. It's a pill, really. They swallow the pill, and now if they drink, they will turn red and flush, and they'll throw up, and they'll get tachycardic. So they are definitely not going to drink, because they are going to feel really sick if they do when they take antabuse. Okay, so that's to stop people from drinking. Methadone stops people from, or not really stops, but it helps them to stay away from certain drugs and alcohol. Methadone helps them to refrain from using opiates. Okay, and naltrexone blocks opiates also. And then we also have residential therapeutic communities treatment, which is like they'll go and live in a program for like a year or two, and while in that program they'll get therapy and they'll learn social skills. They'll also get an education if they haven't finished their high school diploma, then they can get a GED, etc. Okay, so 5 most common reasons for not obtaining treatment for substance abuse. Not ready to stop using. They enjoy using. They're going to keep using. They cannot afford the cost of treatment. Did not know where to go for help. Okay. They fear of negative effects on the job, so they don't want to do it, because then the job will find out, and then that's not going to be good. They worry that their neighbors or the community would have a negative opinion of them if they found out that they were substance abusers. And basically, when we assess these patients for substance abuse, we do a screening, we do physical examination, psychosocial assessment, and we've all done that in the Willows. We've accomplished some of these tasks. So criteria nurses use to evaluate the effectiveness of intervention, okay, of any intervention. That is, okay, has the client remained safe through withdrawal? Because we want to detoxify these patients, get those substances out of them. Has the client refrained from using drugs or alcohol? Okay, have they stopped using? Has the client acknowledged his or her addiction? And does the client use stress management techniques? Has the client identified alternative activities? And is the client participating in a treatment plan? Are they active participants in the whole treatment? So this is some things that we would look at in evaluating their treatment. So I thank you very much, and I'll catch you on the campus.